Good afternoon and welcome to our daily media briefing. Before we get started, I want to acknowledge that yesterday was American Sign Language Day, and we want to thank Loisine, who has been here every day to assist in the sign language interpretation of what we're saying, and also Branton, who unfortunately couldn't be here today. They've done a great job, and we sincerely thank them for their participation and efforts. Today we're going to hear from Supervisor Fletcher with an update on our informational charts and graphs, and then we're going to get a medical update from Dr. Wooten. But before we get to them, I wanted to make note of something that may be a little bit of an inspiration for all of us. It's about something that happened 65 years ago. In fact, San Diego made history 65 years ago as the site of the first mass vaccination against the polio virus. Now, at the time, polio was a frightening disease that had no known cure. Swimming pools and movie theaters were closed, and parents stopped sending their children to playgrounds or birthday parties out of fear that they would catch polio. But on April 16, 1955, more than 28,000 children in San Diego County received their polio vaccines from local doctors and nurses. It was, as the San Diego Union wrote at that time, a day of excitement and triumph. Although polio has not been completely eradicated, the vaccine that was created by Dr. Jonas Salk has saved the lives of so many over the years. And so, as we stand here not far from the famous Salk Institute for Biological Studies that Dr. Salk helped create, I'm comforted to know that our brightest minds in San Diego and around the world are working to defeat this latest plague on humanity. But they can't do it alone. They need our help. It remains up to us to do our part to defeat this virus. So please continue to take the recommended safety precautions to protect yourself and your family and friends. If we do this, San Diego can once again make history. Now please welcome Supervisor Nathan Fletcher.
Thank you, Chairman Cox, and good afternoon. Our message today is that we have to hold the line. We have to stay the course. We have to continue to be vigilant. It is important to note that the danger from coronavirus is just as great today as it was at the beginning of March. It's just as great for us here in San Diego as it has been in Detroit and New York and Italy and other places throughout the world that have had struggles. The coronavirus is just as contagious. It is just as deadly. It has the exact same ability to overwhelm our hospital systems as it did at the outset. In San Diego, our saving grace thus far has been our early and swift action, and it has been the widespread community support that we've seen that has helped us flatten the curve, that has helped us remain under our health system capacity, that has bought us time to begin to prepare for the future. We should be proud of where we are today, but we should not allow where we are today to lull us into a false sense of complacency that we are through this. The virus has not changed. The level of transmission that it can generate has not changed. What has changed has been our actions, and our actions are the things that have put us in a strong position. But if our actions change, we will be just as susceptible to widespread community outbreak. We will be just as susceptible to overwhelming our healthcare and hospital systems as all of those places where you have seen the tragic stories on the news and you have seen the horrific pictures play out. It is really important to note that you cannot rebuild an economy if you are in the midst of a pandemic outbreak that is overwhelming your healthcare system capacity. And so what is most important for San Diegans, for all of us to keep in mind, is that we have to stay the course. We are only halfway through the month of April. And if we loosen, if we lose our focus, if we become too antsy, then we could very well trigger a situation here, the likes of which we've seen around the world and the likes of which we have praised our efforts to date as having avoided. And so we continue to ask you to adhere to the guidance to stay strong. We know that it's difficult. We know that it's challenging. But you can't begin to move forward until we are truly in the best possible position to be able to mitigate the spread, to be able to contain the dangers, to be able to continue to work with our healthcare system, to continue to acquire more personal protective equipment, to continue to get the testing we need, and make the plans to move into another phase. And I want to share with you a cautionary tale that I think should serve as a reminder to us all. Singapore has been held up as one of the models around the world of what folks should do. And what you see on the chart that you're looking at right now is Singapore was a model. They took early actions, they took swift actions, they saved lives. But then Singapore lost their focus. They did not do a series of steps specifically to ease or to unwind, but they did have the public lose the same commitment that they had in the early days. And so if you look at this chart, what you see in the orange line is you see the San Diego new cases by date, and you see overlaid there all of the actions that we took. Our public health officer orders, mass gatherings, social distancing, staying at home, face coverings, and you see the success we've had. But if you compare San Diego County to Singapore on the same trajectory and timeline from the first cases and adjusted for the population of both entities, if we follow the path of Singapore, you can see that dotted blue line is what would happen here in San Diego County. And that represents an entity that got ahead of the curve. It represents an entity that took action. It also represents an entity that lost their focus a little bit. And this is what we are trying to avoid. The concept of exponential growth is such that at the point at which you have significant spread, you have a much less ability to stop it. And so we are asking each and every one of you to continue to hold fast, to continue to stay the course, to remain vigilant, and continue to work through this with us. We want to continue that solid progress we've seen. We want to continue to be in a position of strength. We want to continue to have the ability to prepare and plan and implement the next phases when appropriate in the right way. And that is vitally important not only to saving lives and protecting public health, but that is vitally important to having the ability to have an economy recover in a smooth line. Before we get into our reports, I want to update on two other things. You've heard us talk about doubling times during our briefings. You see a lot of conversations in the media for other jurisdictions and other places where the notion of doubling times is an indicator of the progress, success, or failure of your region and what direction you're heading. And so we're going to start today and every day moving forward disclosing our doubling times for our positives, for our hospitalizations, ICUs, and deaths. But it is important to note, I want to share with you how we calculate this doubling time so you have an understanding of where we derive the numbers and a little bit of the thought process behind it. Some individuals will simply take the total, cut it in half, back up that many days, and say that is how many days our current doubling rate. The problem with that is given the batching of testing, the batching of results, the inconsistent nature. We always say don't take one particular day as an indication of where we're going, look for a trend. Because of that, you don't want to simply cut the number in half, back out, count the number of days, because you'll see things like if you look at March 28th, our doubling rate of positive cases under that model would have been 11.3 days. The next day, our doubling rate would have been 4.6 days. The doubling rate in San Diego County did not change that much in one day. And so our team here has been working very hard to come up with a formula that takes into account a smoothing over a period of days. The New York Times uses a 7-day smoothing. Scripps Research uses a 5-day smoothing. Some jurisdictions use a 3-day smoothing or average. Some use a 6-day. Here in San Diego County, we've settled on a 5-day rolling average of doubling rate that we think will best account for the erratic nature and inconsistencies of test results, but still give us some clarity and insight into the present state. The second thing is that we're not compounding this on a linear doubling. We are using it under a formula that takes into account exponential growth. Anyone who's worked in finance will understand compound interest in terms of exponential growth, in terms of the rate of the cases. And so we've worked on a formula with experts and researchers at UCSD, Scripps, and San Diego State, who have all given their stamp of approval to the formula we're using. And if there are any math professors with time on your hands and you would like to see the actual formula, we would be more than happy to share with you the technical formula that we are using to get it. But you will see in the charts in a few minutes, and I will point out the doubling rates for each of these entities. But again, it is a formula that accounts for exponential growth over a 5-day average, and we will share those in real time moving forward. Last update relates to the homeless. We have obviously seen the challenges and situations that San Francisco had in one of their shelters. That type of situation where you had an overcrowding in a congregate care setting with the inability to do physical distancing is what led the city, the Regional Task Force on Homeless, the Housing Commission, and the county to move forward with the convention center to get individuals out of a bad situation into a less bad one where we could ensure physical distancing. We also took early actions and steps to put public health nurses in our shelters to do temperature checks and look for symptoms and immediately get individuals who exhibited symptoms or fever out of those settings for further evaluation. We also had public health nurses with our homeless outreach teams for those who are unsheltered. We have public health nurses and teams in the convention center daily doing screenings and temperature checks and monitoring, and a system and protocol in place that anyone who exhibits symptoms can be moved out. But it was concerning today, the report out of Boston, where they went in and tested asymptomatic individuals in their shelter and determined a number of them have been positive. This is why we have been putting in place for the last few days a process in partnership with the Lucky Duck Foundation and Family Health Centers to test every single individual in the convention center, to go through whether they were all asymptomatic. If they have symptoms, they would already be removed. But we want to test those. We've got a system in place for anyone who tests positive to be immediately isolated and then transported to a public health motel room where they will receive care and help during their recovery phase. But we continue to do everything proactively we possibly can. We generally have not been in a position to be able to test wide groups of asymptomatic individuals, but thanks to the generosity of philanthropists and the partnership of a health system, they're able to do it. We think that it is appropriate, we think it is proactive, and we think it is an additional step we can take to try and protect these populations. They're starting today. The hope and estimate is that they can do 150 tests today. As we get those results, we will share those with you, separate and distinct from the rest of the results that we share. For today's totals, we have one additional homeless individual who's tested positive, which takes us to a total of 15. So with that, we'll jump into our charts for the day. You see today we're reporting 75 new positive cases, which brings us to 2,087. Testing, 1,248 tests were reported to us in the last 24 hours for a total of 29,000. There has been a lot of discussion around testing. This is obviously an issue of concern, both in how we maximize the testing capacity that we have now. Our county team is working in close collaboration with our health system partners to evaluate criteria and see what we may be able to do to maximize the capacity that we have now. And then we also have this separate effort underway, the long-term planning for how we have much wider spread testing as we move into the future that we would like to see. The spread between test and positive is about 96.3% of the tests coming back are negative. You can see the breakdown there. This chart is a daily chart that you're used to seeing. This next one, what you see in parentheses, outlined in parentheses right there beside the positive numbers, is the doubling time in days. And so for our positive cases, we're now at 2,087. Of course, we reported a daily increase of 75 positive tests. 18.4 represents our 5-day average of exponential growth in terms of a doubling rate of 18.4 days, and we will continue to update that every day. For recovered, you see an increase there. Again, this is estimated recovery based on date of positive test and adjusted for the loss of life. Hospitalizations, you see right there an increase of 29 from yesterday. Our rate of doubling in hospitalizations on the formula we outlined earlier is 12.6 days, doubling every 12.6 days. ICUs is an increase of 8. That represents a current doubling rate of 15 every 15.3 days. And loss of life, we have 3 additional deaths, which represents a doubling rate of 7.6. And again, we will add those doubling rates in parentheses beside each of those numbers on this chart every day moving forward. Moving along to hotel rooms, not a significant change in any of the status there, some modest changes. Outreach efforts continue. 211 calls are up, nursing call lines are up, EPI calls are up, relatively flat on the other outreach efforts. Personal protective equipment, we saw a jump in every single category, more N95 respirators, surgical face masks, face shields, goggles, gowns, and gloves, all increasing in our distribution to our health system partners. We're now at 2.1 million individual items of personal protective equipment that have been distributed. Our final chart here is ventilators. 22 of 23 hospitals reporting an increase of 572, primarily due to the entities that reported. But again, general consistent participation and help by our hospital partners, which we appreciate. 572 ventilators are available for use today if needed in San Diego County, along with those the county has in ready reserve. That concludes my section of the report, and I will now turn it over to Dr. Wilma Wooten for the Public Health Officer's briefing. Thank you.
Thank you, Supervisor Fletcher. Good afternoon, everyone, and thank you for being here with us today. April continues to be a vital month, as you've heard from Supervisor Fletcher, and this is, again, to help decrease COVID-19 cases in San Diego County. County residents have been doing a great job so far, but we need you to continue to adhere to social distancing strategies. So kudos to staying the course, and we need you to hang in there and continue the same for the next several weeks. Regarding global, national, and state statistics, based on data from Johns Hopkins dashboard at about 12 noon today, globally we have just over 2.1 million positive cases, which includes over 140,000 deaths. Nationwide, for the United States, there were almost 650 positive cases reported, which includes about 31,000 deaths. Statewide, for California, there were 27,109 positive cases, which includes 890 deaths. And today, the County of San Diego is also reporting 2,087 cases, which is 75 more cases than reported yesterday, and 63 deaths, which is 3 more deaths than reported yesterday. Of the 3 additional deaths, these include 1 female in her late 30s, 1 female in her late 70s, and 1 male in his early 50s. All of these individuals had underlying medical conditions. Of the total number of cases, the age range remains 3 months to 100 years of age. 1,077, or 52%, of the total number of cases are between the ages of 20 to 49 years of age, and this percentage remains constant. 1,034, or 49, almost 50% of our total cases are female, and 1,047, also approximately 50%, are male. 507, or 24% of the cases, have been hospitalized, and this includes 181, or approximately 8.7% of the total number of cases, have been admitted to the ICU. This number is 36% of the total number of hospitalized cases. And for the 63 deaths, these represent 3% of the total number of cases. 44% were female and 56% were male. Regarding race and ethnicity for this group of the 63 deaths, we have data for 50, which is 79% of the total number of deaths. 26 or 52 are white, 18 or 36% are Hispanic or Latina, 4 or 8% are Asian, 1 or 2% are Pacific Islanders, and 1 or 2% is of multiple races. None of the death cases have been African American or American Indian. And 13 of the 63 had unknown race and ethnicity information provided. Our sincerest sympathies, again, go out to the family and friends of the individuals that, for whom we've announced as being cases that have died over the past several days. All of our information is found on our website at www.coronavirus-sd.com. Now regarding outbreaks in congregate and community settings, today we are reporting a cumulative total of 34 confirmed outbreaks, which is 1 more than reported yesterday. These include, cumulatively, the county has had 20 outbreaks in congregate care facilities representing 285 cases and 36 deaths. 1 of the 20 is now inactive, and there have been no new COVID-19 cases reported in the past 14 days for this facility. There is also a total of 14 outbreaks in community setting locations, which includes one new outbreak and represents 65 cases and one death. Regarding testing, as of April 15th, county, hospital, community health facilities, and commercial laboratories have conducted 29,132 tests, which includes the current total of the 2,087 positive tests, which it represents 7% of the total, and this is still holding for the past week. Lastly, today, I am again excited to announce the East and North Central Regions 2020 Live Well San Diego 19th Annual Public Health Champion Award recipients. This year's East Region recipient is Meredith Rifle. As the director of the Santee Community Collaborative, she helped exponentially compound the positive impact and reach of the collaborative. Meredith has contributed to bringing an anti-bullying program to the community, which looks at the cultural components of families living in low-income housing to understand ways in which the school can better connect with families and increase attendance rates. This year's North Central Region recipient is Veterans Village of San Diego, an organization committed to serving veterans since 1981. The Veterans Village of San Diego is the only program of its kind in the United States and is nationally recognized as the leader in serving homeless military veterans. For these reasons, I am excited to announce Meredith Rifle and the Veterans Village of San Diego as this year's annual Public Health Champion Award recipients for East and North Central regions. Please welcome back to the podium Chairman Cox.
Thank you, Dr. Wooten. We'll get right into the questions again. We have 3 calls waiting. As you are introduced, please make sure if you're not introduced by your name and your outlet in the introduction, please do so before you ask your question. Let's go to the first call.
KPBS, please state your name and question.
Hi, this is Matt Hoffman calling from KPBS. On the COVID clinic, Miracosta College officials say as of this morning they're no longer operating there. Did you ever receive their CLIA certificate or the lab information on the accuracy of tests or get any test results? And I ask because the operation says right now it's going through the, quote, red tape required by the county.
Okay, Dr. McDonald's going to answer that question.
Thank you for the chance to do follow up on those questions. There were a lot of or that question. There were a lot of questions about this yesterday. We have worked with the California Department of Public Health Laboratory Field Services and also the COVID clinic leadership, and we determined that they do not have a CLIA certificate to be able to do the testing that they were performing. Also, they don't have the certification to be able to send specimens to a laboratory out of state to do PCR testing. This isn't red tape. This is actually verification of standards and quality. So we are working with them to see if they can refocus their effort to do PCR testing that would allow access to laboratories which do give good results, such as LabCorp and Quest. And again, we're working with them and the laboratory field services to make that happen, hopefully in a timely manner.
Yeah, and I know yesterday, Dr. McDonald, you said that you don't want to make it seem like all drive-through activities here are of concern, but we know there are similar pop-up testing options here, and people clearly want to use them, but how are San Diegans supposed to know which ones are legitimate and actually worth their time and money?
Well, I think I would just do a little bit of buyer beware. If it's a pop-up with an organization that is not affiliated with one of our well-established healthcare entities here in San Diego, I think that would be my first clue. But again, we want to be able to work with anybody who can set up a process that allows for rapid, efficient, and safe testing of the public. And we hope to be able to work with this particular organization to reach that goal.
Thank you.
Okay, let's go to the next question.
NBC7, please state your name and question.
Hi there. My name is Lauren Coronado. I also have a question in regard to COVID clinic. I understand that they told their customers by email that they'd plan on opening another location in San Diego County. Are county officials aware of that? And if so, where is that new location expected to be?
Okay, Dr. Wooten will follow up on that.
Actually, we're not aware of another location by this specific company. We don't know that this company actually also operates clinics in other counties. So we, again, are happy to work with anyone to set up a process that is, in fact, CLIA certified, has quality that can be verified, and gives test results that are appropriately messaged to the individuals who are being tested. So again, we will continue to work with this particular company and any other company that wishes to provide these types of services in San Diego County.
Thank you. And this may have been touched on, but are these private companies required to hand over their results to the county, in particular if someone tests positive?
Well, California law actually requires that any positive tests for COVID-19, or specifically the virus that causes the disease, is reportable to local public health within 1 hour of the results. And so that is currently part of Title 17, Section 2500 and 2505. So in order to comply with the law, they do need to be reporting those results to us.
Okay, thank you.
That was actually Dr. McDonald. We'll go to the next question.
We have another call from NBC7. Please state your name and question.
Oh, I don't know if you had me on there. It's Paul Kruger. But my questions were answered last go around by my colleague.
Thank you. Then I think we're ready to go to the text questions, since we don't have any other call-ins.
Yes. This question is from Fox 5. Can county health comment on the status of FDA-approved antibody testing available in the county? And what should people be on the lookout for regarding advertisements for non-legitimate antibody tests?
Dr. McDonald's going to answer that question.
I think it's very understandable that there are a lot of questions about serology testing. Actually, it's not just the public that has those questions, but providers have those questions, and even we in public health have questions about the specific tests that are being offered at the present time. I think the best thing and the first thing to do is to look on the FDA's website to see what has in fact been an approved test. That changes every day. Things are actually added that have gotten emergency use authorization. And I would check to see that the test that's being offered to you, whatever venue it happens to be in, is in fact one that's on that website. And if it's not, there may be some permissible use of tests that aren't yet EUA authorized, but they need to be provided with notice to the individuals about the limitations of those tests. So I think my advice would be to work with a trusted provider that you've already worked with, and understanding that each of our systems in San Diego are having more and more testing capability brought on board each day, and that serology will be part of that mix, and then understanding the tests that are available, the symptoms you may have had or have, and then in conjunction with a provider to be able to pick the test that's best for your situation.
And Dr. McDonald, I have a related question from KUSI. Experts seem to agree that more testing is needed before recovery can get underway, but our county has a very low rate of testing, only for those with obvious symptoms or recommended by a doctor. Are you going to accelerate testing, and when?
Well, again, I think we've talked about how testing capacity is increasing all the time with this new type of testing being added to it that may be useful in some specific situations. It does appear that some of our systems have some capacity over and above the priority groups that we have been emphasizing that need to be tested. And as we are able to expand that to new groups of individuals, that each system will communicate that to their patient populations, and we in the county will be also doing the same. Supervisor Fletcher actually gave a great example of how we are targeting specific populations to give some of that testing capacity to, such as homeless that are in the convention center. We're also working with specific federally qualified health centers to be able to make sure that their underserved patients are able to get access to testing. We're also working with skilled nursing facilities and other partners to be sure that we are doing wider coverage of individuals who may not be symptomatic now, but yet in a congregate setting in which other cases have occurred. So I think that as we're trying to direct this capacity to an ever-increasing group of individuals, and we hope that we'll be able to offer it to the entire community sometime later on.
Thank you, Dr. McDonald.
This next question deals with homeless being housed at the San Diego Convention Center. Supervisor Fletcher is going to give a partial response, and then Dr. Wooten will answer the latter part of the question.
Thank you. This is from Lisa Halverstadt, Voice of San Diego. Given the escalated COVID-19 risk for individuals in congregate settings and the particular vulnerability of the homeless population, what guidance has the county offered to residents and staff at the convention center and other homeless shelters when it comes to face masks? And now that COVID-19 testing has begun at the convention center, what actions is the county recommending if someone does test positive, both for the individual who tests positive and others who may have been in beds immediately surrounding them?
So on face coverings are required for individuals who are in the convention center. The County of San Diego provided 2,000 face coverings for the guests. We've provided additional personal protective equipment for the staff, personnel and outreach workers who are there. And we think that that goes well with the efforts around physical distancing that are put in place. That goes well with the efforts around temperature checks and searches for symptoms. And that goes well to do the very best that we possibly can to ensure that that congregate care setting is as safe as possible in terms of utilizing and meeting all of those criteria and every tool that we have. Any individual who shows symptoms or as a result of a test, an asymptomatic individual who tests positive will immediately follow the protocols that have already been put in place with immediate isolation, transportation to a public health motel room, and additional care for the duration of their episode with COVID-19. Any individual who had been in contact with that person, if they would have been tested along the same way. So if they're negative, we would continue to monitor and guide them. That is one of the advantages of being able to go in and do widespread asymptomatic testing in that location, as hopefully it'll help us identify those individuals who are positive, get them removed, know the other individuals are negative, but continue to monitor every single day the temperature, the symptoms, continue to enforce physical distancing, continue to look for every possible thing we can do around cleanliness, hygiene, hand washing, face coverings, and other things to try and mitigate the dangers that environment poses.
I think the second part of the question is what would we do if we have a homeless individual that's in the shelter that would test positive. And we would do the same thing that we would normally do when we have a positive infectious disease. We have case investigation and contact investigation. So that process does not change no matter what the setting, particularly now that during COVID-19 with homeless population and with our long-term care facilities, we have actually implemented, just as we do with outbreaks for influenza, we developed a COVID-19 outbreak plan or protocol, and the same processes would occur. Staff would go into the facility, particularly if there's more than one, and actually 3 cases as investigating as an outbreak. but we would still do the investigation even with one case. But when we would have an outbreak, we would have a team that goes down to assess the location and identify infection control and prevention measures and opportunities for improvement. Now, that also fits in with the larger question of testing, both in the homeless environment as well as our long-term care facilities. And our public health laboratory has now convened a task force, not only of staff within public health, but also including staff from hospitals and from the federally qualified health centers and commercial laboratories, specifically for long-term care facilities, to look at how are we going to expand testing ourselves for that area, but also the other sectors. What are some niche areas that they can expand testing? And the overall intention there is to expand testing overall across the entire county. So that was implemented early this week, and we will report more on that at the Board of Supervisors meeting next Tuesday. Thank you.
That completes our media questions for today, but as always, we always like to end these sessions on a positive note, and I would like to share with you some of the really positive things that are going on throughout the San Diego region. In Encinitas, bicyclists are teaming up with Union Co-work Encinitas, Feeding San Diego, and Padres Pedal the Cause to run a very unique, contact-free food collection via drive-through or a bike-through system tomorrow. You can bike or drive to the food drive from 10 a.m. to 2 p.m. in Encinitas. People are being encouraged to enter the north end of Union via C Street Alley. For more information, you can go to Feeding San Diego website at feedingsandiego.org. As a longtime supporter of the bicycling community, I'm very pleased to see this happening, so good luck tomorrow. And in Chula Vista yesterday, medical staff and workers at Sharp Hospital and Scripps Hospitals in Chula Vista were treated to a salute from the local police and fire department. They flashed their lights and turned on their sirens to thank those healthcare workers on the front line of the fight against this epidemic. Lastly, don't forget to sign up for our #StayHomeSD campaign. Send us a photo of a loved one that you've pledged to protect by following a simple request to stay in place, maintain space, cover your face. To submit your photo or take the pledge, go to coronavirus-sd.org. We'll be back here tomorrow at 2:30, and until then, remember to stay in place, maintain space, and cover your face. Thank you.